If you've been out and about or in the office, you've likely noticed all the coughing, all the sneezing that's happening this time of year. Well, today I had a chance to speak with New York State Health Commissioner Dr. James McDonald about sick season and how local health centers can be proactive in fighting the flu and other illnesses.
Yeah, so one of the things we did this week was remind healthcare facilities that we are seeing a lot of RSV, we're seeing a lot of COVID, we're seeing a lot of flu. And so protecting healthcare workers, requiring them to wear masks is something we recommended that they do. And this is one of those things that we've talked about throughout the year, but as we see these cases increase over the last several weeks, now is the time for me to remind healthcare facilities, this is a tool. We want to protect our healthcare workers, and that's why I sent out the message. And I was just noticing the new COVID variant, JN1. You know, this is something we've seen the last couple of weeks become dominant in New York State. You know, so it does make sense now to take those extra precautions.
What do the latest numbers in the state tell us about the cases of COVID, RSV, as well as the flu?
You know, it's the hospitalizations that I really follow the most. And it's interesting, like when I look at the last week's data, we have 3,200 people plus across the state in the hospital related to COVID, a little over 2,000 related to flu. So the numbers are going up. I don't think that we've peaked just yet statewide here. Now, for RSV, you know, we don't really track the hospitalizations yet. We see the cases kind of flattening out with that. Suffice it to say, though, it's the time of the year when people get sick. I'd like people to be healthy. You know, what's interesting about 2024, though, is I have a vaccine for all three of these diseases, right? You know, RSV, COVID, and flu, I have a vaccine for you.
Yeah, that's definitely different. When it comes to mask wearing, as you know, some people like them, some people don't. But when do you recommend people definitely wear a mask?
You know, I would think about it. And I think if you're someone who your immune system isn't quite what it should be, you're going to be in a crowded indoor setting, I think that's something if you're going to wear a mask, get an N95, a high quality mask. Go ahead and do that if you're someone who's exposed. If you're someone who just wants to because this time of the year you don't want to get sick, I think it's a great idea as well. Totally up to you.
I spoke with the physician yesterday. He indicated that some of the home tests people are taking don't always show positive results until maybe the third or fourth day of the illness. Is this because of that new variant that you were speaking about? And if people have sniffles or sore throat or they're coughing, should they wait a few days and then test?
You know, so what I encourage people to do is test as soon as you feel symptoms. And the new variant is still covered by the current tests we have. But if the test is negative and you're still feeling symptoms in a couple days, go ahead and test again. This is true with tests. Sometimes you don't pick it up right away the first time, but it's a reminder that if you're not feeling well, try not to work if you don't have to go to work. So work from home if you can. Try not to go to school if you can, just to sort of make sure you're feeling well. You know, we don't want to spread disease when we're feeling sick, you know, and it's something we used to do in our culture. We all go to work sick and almost as a badge of honor. But, you know, quite frankly, I think during the pandemic, we all learned that if you're sick, you probably should stay home and not spread it to your coworkers.
Dr. James McDonald, New York State Health Commissioner, thank you so much for joining us today on the 530.
Thank you, and go Bills.